It is hard to imagine in a country like the United States, but each year about 700 women die during pregnancy or in the year after from complications.
Yeah, and the risk is even higher for women of color. WESH News' Gail Pascal-Brown explores why this is happening and what needs to change.
The postpartum period is when we know that most of the deaths are going to happen.
I'm sorry, sweetie.
And that postpartum period can be anywhere from the time of birth all the way up to the first year of life.
For decades, it's been a grim reality.
The United States of America has one of the highest maternal mortality rates of any so-called developed country.
Black women in America are 3 times more likely to die from pregnancy-related cause than white women.
Native women, twice as likely. Rural women, 1.5 times likely.
Concerning opening remarks in April from Vice President Kamala Harris, who spoke during a first-ever meeting of cabinet officials to discuss the administration's plans to improve maternal health. Deborah Brown is an advanced practice registered nurse and certified nurse midwife at Advent Health, who's equally concerned.
The onus is on us as healthcare providers and patients. I think we need to hear our mamas. We need to understand them, see the whole person.
Listening was everything to Bianca Doughton of Orange County, who felt she wasn't being listened to. She had a high-risk pregnancy with her 3rd child, Trevor, at another hospital.
The doctors there weren't really trying to manage my high blood pressure, and it was just getting worse. I felt like the best thing to do was to check myself out against doctors' wishes.
She discussed the matter with her husband, and they ended up at Advent Health's main campus.
They ran my blood pressure. They gave me medications to kind of try to lower my blood pressure. But I think within 12 hours of being admitted to Advent Health, I had a C-section and Trevor was born.
At 32 weeks, Trevor weighed only 4 pounds and was in the newborn intensive care unit for 15 days. Bianca also learned she had kidney disease. Underlying health issues is one major factor adversely affecting Black mothers. Another is access to health care. The third barrier is implicit bias or stereotypes. The Centers for Disease Control says health care providers need to recognize unconscious bias in themselves and in their office.
And one of the nurses confessed right there in front of me. Yes, I thought it was because of the color of your skin that you could take more pain.
I said normal, 150.
The CDC says to further reduce Black maternal mortality, healthcare providers need to ask questions to better understand their patients. Deborah Brown says patients need to ask questions too.
The patient should be asking, where are we now? How's my status? What do I need to do about any of my numbers? Is everything okay? What I find patients are more consumed with the gender reveal.
Bianca wasn't sure she and her husband would have another baby. Trevor came 2 years after she lost her second, Tristan, to complications. She says her oldest, Tatiana, was a smooth pregnancy. Her advice, find the right doctor.
And I had to, switch doctors, mid-pregnancy to someone who would actually listen to me and wouldn't just write off my concerns.
Bianca now blogs about her experience and shares advice, helping women with, among other things, tips for advocating for their own health.
We want these babies to come out healthy, and I want you to be here to see the babies come out healthier.
In Orange County, Gail Pascal-Brown, WESH 2 News.